Welcome everyone to today's food safety webinar. Thank you for joining us. Today's webinar is Farm Worker Health and Hygiene, your first defense to food safety on the farm. Our speaker today is Dr. Stephanie Smith, and she's with Washington State University. My name is Colette D. Phelps, and I'll be your moderator today. Just a couple of webinar tips when we get started. It will be helpful to you if you could close all the other programs running on your computer so you can put all your bandwidth into watching this webinar. If you do have problems with your sound, the clarity of the recording, speed, you can switch to the phone. A call-in number was provided in the welcome email. And if you do call in, please mute your computer sound when using the phone to prevent feedback. At any time, you can type questions in for Stephanie. There's a question box at the bottom of your screen. Simply click on it, type your questions in, and at the end of this webinar, she will take a few minutes to answer any questions that you may have. If you have any technical issues, problems with your sound, and you'd like assistance, go ahead and use the chat box. I will be monitoring that, and I will be able to help you out. And so I'll watch that throughout the webinar. We are going to have handouts that will be available for you to download following the webinar. And on our last slide, I will show you where you'll be able to find the link to download those handouts. So don't worry about taking notes on everything that's written on your screen. You can just sit back and enjoy the webinar. Thank you for joining us. With that, I'll go ahead and hand it over to you, Stephanie.
Hi, thank you all for joining us today. I will try to advance this to the next slide. Okay, so I just want to give you an overview of what we're going to talk about today. I'll give you a little bit of an introduction and then some brief microbiology 101. We'll talk about contamination by workers and then steps to reduce contamination. We'll talk about worker training, and then with that, we will summarize the webinar and then take any questions you may have. So the first thing I'd like to do is show you a brief video, and let me switch that over.
Contamination of produce can occur at any step in the process. Fresh produce doesn't have a kill step, and once pathogens have contaminated
Stephanie, you'll have to unmute because we can't hear the video if you mute yourself.
if your workers...
Thank you for letting me know. I'll start the video over.
Contamination of produce can occur at any step in the process. Fresh produce doesn't have a kill step, and once pathogens have contaminated produce in the field, they are hard to remove. Your workers are your first line of defense to keeping produce safe. Illnesses, including diarrhea and vomiting, can contaminate produce. If your workers are ill, they should notify a supervisor and be assigned to duties away from the produce or sent home to rest. Create dedicated areas where workers can eat, drink, smoke, and use the restrooms. Remind your workers they must wash their hands after any of these activities. Keep restrooms stocked and well maintained. Soap, water, paper towels, and waste cans must be provided at hand washing facilities. Gloves, boots, and clothing should be changed when visibly soiled or after coming into contact with animals or feces, all of which can spread bacteria and viruses onto crops. Keeping clean gloves on site and dedicating footwear for specific activities can help your workers keep produce from becoming contaminated. Since they're in direct contact with produce, they're more likely to be able to detect animal activity, fecal contamination on crops, and damaged crops. So training them on what to do when they run into these things will help keep the produce safe. Be sure your workers know to never harvest produce that is visibly contaminated with feces or has been dropped. They can also let you know if tools, bins, or equipment appear to be contaminated or are in need of repair. Remember, If your workers are properly trained, they can be your most effective way to making sure produce makes its way to the table safely.
Okay, so that pretty much gives an overview of what we're going to talk about today. So produce safety really begins on the farm. Contamination of fresh produce can occur at any step, and the major problem is that fresh produce does not have a kill step, meaning that there's no heat or processing step to eliminate potential disease-causing microorganisms or pathogens on the produce. So once the produce becomes contaminated, it's really hard to remove the microorganisms from the produce. And that's one of the reasons why, you know, when they get into getting processed for sale at stores, for instance, where you start to see multi-state outbreaks, is because then the produce gets mixed with other produce and the pathogens are still there and everything ends up contaminated. So the reason why we're so interested in fresh produce safety is because there's a lot of illness outbreaks from fresh produce. So in the US from 1996 to 2010, approximately 23% of all outbreaks were caused by produce. And from 2006 to 2014, out of 68 multi-state outbreaks, 16 of them were caused by vegetables. So bacteria end up causing the most outbreaks, illnesses, and deaths. So we usually focus on bacteria the most. And the one thing that's really important to understand is that foodborne illnesses are much more than just a 24-hour stomach flu. They can really cause lifelong illnesses. A lot of people have issues with autoinflammatory disease after becoming ill with a foodborne from a foodborne pathogen. People, you know, a lot of times can end up having gastrointestinal issues for the rest of their life, organ failure, and sometimes people can even die. So it can be very serious. So the goal is to really prevent produce from becoming contaminated in the first place. We want to avoid that. Anytime that there is a foodborne illness outbreak, such as the last two romaine lettuce outbreaks, those really have a negative impact on all romaine. It didn't matter if growers were a part of that recall or outbreak or not. It still really impacts everyone. And so it's important for everyone to take steps to keep produce safe. I'm going to talk a little bit about the microbiology behind pathogens contaminating produce and just discuss some of the pathogens that can cause illness or that could be a concern for produce. And I will discuss ways in which this workers are involved in this, of course. So microbes can be passed from people to food, so that's the major concern that we're looking at with this particular webinar, is trying to keep that from occurring. And so some of the microbes that can be passed from people to food include bacteria, parasites, and viruses. So viruses reproduce in human beings, and so when they are carrying a virus in their system, they can shed that virus onto produce, and then these viruses a lot of times will survive both freezing and cooking, which again means that there isn't a kill step to remove them from fresh produce. And they usually contaminate the food when through poor personal hygiene of a worker and somebody that's handling food when they're sick. So some examples of this are Norovirus and Hepatitis A. There's been several recalls in foodborne illness outbreaks due to hepatitis A. There was one in particular I remember that was an import of strawberries, and those ended up into California school food systems. So there were students that were eating these strawberries that were contaminated with hepatitis A, and it was a really big deal. Norovirus is another one. Again, we're looking at transmission sources being the fecal oral route. So basically, somebody's hands get contaminated with feces, whether that's from handling something that's produce that's come in contact with feces in the field, for example, and then they handle other food. And then somebody eats that food, and then now they are carrying the virus. Person-to-person contact is an issue, and so is contamination of food and water. Water, for example, can become contaminated if someone's septic system leaks, or there's improperly treated sewage that's been discharged into agricultural water. So that's something to be aware of. The infectious dose of norovirus can be really low, so we're talking less than 100 viral particles. And even if somebody is over the actual symptoms of having norovirus, they can still shed that virus for a really long period of time. So somebody even with an immunocompromised system can shed the virus for several months, up to a couple of years. So it's really important to be practicing good personal hygiene. Hepatitis A has similar transmission and sources. And with this, usually one of the symptoms you see is jaundice. So a person has yellowing of the eyes or skin, and then also stomach pain and nausea. It usually resolves within 2 months, but during this time that somebody's carrying hepatitis A, they can contaminate produce. Parasites do not grow in food, but they can be passed from humans or animals, animal feces, or contaminated water onto food. So although they're not replicating on the food and making more of themselves, they can survive on the food until someone ingests them. And so there's a lot of different examples of parasites. One of them I'm going to talk about just as an example is Giardia. So Giardia can survive outside the body for long periods of time, and it's also tolerant to chlorine disinfection. So even if your produce is washed in water containing a chlorine solution, it's not going to kill off the parasites. Transmission sources are usually through from being passed in feces or contact with feces, transmission from person to person, and then of course contaminated water. So parasites are known a lot of times to come from contaminated water sources. And again, symptoms can begin 1 to 3 weeks after infection, but sometimes it's even longer, and they can last quite a while. So bacteria, as I had mentioned, are the ones that we really focus on because they cause the most illnesses, outbreaks, and hospitalizations and deaths. So bacteria are a little bit different from viruses and parasites because they can survive and grow in the environment. And many, such as Listeria, can even grow during refrigeration temperatures. So although refrigeration may slow growth a little bit, it doesn't stop it. They're easily passed from humans and animal feces. Ill workers can spread bacteria onto produce. And then, of course, contaminated water is also a source. Consumption of contaminated food and water results in infection. And there's many different types of bacteria, but some of the ones that I have listed here are E. coli, Shigella, Salmonella Typhi is a big one because that's passed from human to human and can easily contaminate produce, but so can Salmonella from other sources such as from birds. I have an example here of Pathogenic E. coli. So it usually originates from animal sources, and humans can become infected, but if they're not, if a human is infected and they are not practicing proper hand hygiene, they can also contaminate fresh produce. As well as animals entering into a field and defecating in a field. That's also a potential source of contamination. Some of the symptoms for E. coli are very severe, including bloody diarrhea and then hemolytic uremic syndrome, which basically results in kidney failure. And it can also cause death. The onset of the illness is usually 3 to 4 days, but it can last as long as 2 to 9 days. And as I mentioned, this can result in really severe complications, which can then end up being lifelong complications, even if the bacteria have cleared already. I did mention Salmonella Typhi. This is carried in people's bloodstream, intestines, and feces, and is easily passed. It can be passed between workers and then also onto produce. This is often linked with ready-to-eat foods. So again, looking at fresh produce, because there isn't a way to kill the pathogens once they've contaminated produce. And one of the major concerns is that Salmonella Typhi can be in person's feces for weeks, even though they may not be showing symptoms. So workers really can spread contamination. So ill workers are handling produce, especially if they're having diarrhea or vomiting, can be a really big risk factor. So it's going to be really important that workers do not handle produce when they're sick. Also, workers that are moving between manure, compost, or farm animal areas into growing areas can spread contamination. So they might be stepping in untreated manure or compost. In one of the pictures I have on the screen, there's a woman gardening with her chicken in there. The chicken could potentially be contaminated with salmonella. They're natural carriers of salmonella, and they could be spreading salmonella contamination onto the produce. So that's one thing to avoid, is for workers, first of all, not to be in contact with animals when they are working in growing areas, and then also to exclude animals from the growing areas. Workers should not be eating, drinking, or smoking in growing areas because they're having that hand-to-mouth contact and then touching plants, which is a way to potentially spread illnesses onto produce. And then workers not washing hands adequately after eating, drinking, smoking, or using the restroom is another way that produce can become contaminated. Because again, we're looking at that route from the mouth back onto the produce. Again, workers can contaminate tools and equipment. So for example, if they're using tools or equipment in an area that is contaminated with feces or is untreated manure or compost, and then they go and use those tools or equipment over in a growing area, then you can now contaminate the produce with pathogens. Gloves, boots, and clothing, as mentioned in the video, is really important to pay attention to. So for instance, if a worker wears the same boots from an animal area into a growing area, that can cause cross-contamination and contamination of the produce. And then it's really important that workers have well-stocked and clean facilities for toileting that are close to the working area. If they're far away from the working area, then it's less likelihood that workers are going to be using bathroom facilities. And it's really important that they have the ability to have access to those so that people aren't defecating or urinating in the growing areas. And then one other way that workers can spread contamination that I want to point out is that injuries can be a big problem. So if a worker cuts themselves and then bleeds on the produce, or for instance has a wound that's uncovered and is potentially has pus coming out of it, then they can contaminate produce as well. There's a lot of steps that can be taken to reduce contamination. So one of the #1 steps that you can take is to maintain personal cleanliness. So the workers should have clean clothing, gloves, and footwear. They should be maintained in good condition. And also they should be changed if they do become dirty or have come in contact with feces or animals. It's also really important to remove or cover jewelry, because jewelry, if it falls into the produce, can then become a physical hazard. We didn't really talk about physical hazards in this presentation, but if it falls into produce and somebody eats it, it could cause dental damage, choking, and other issues. So it's really important to have jewelry removed or covered. Also, if people are wearing, for instance, hand jewelry such as rings, then that is a place that could harbor bacteria as well and could also contaminate pathogens. It makes it harder to have efficient hand washing. It's important that workers are not eating, smoking, or drinking during work activities. You should provide a dedicated area for the workers to be able to take breaks and to be able to eat and drink. I know that there's been a lot of questions about on those hot summer days when harvesting activities might be going on, that workers need to stay hydrated, and that's very important. But it's also important to make sure that there isn't a contamination risk for the produce. So even if there is an area for them to take a short break and drink some water at the edge of a row, that can be very helpful for preventing produce contamination. You definitely want to exclude ill workers, especially those that are jaundice, have vomiting, diarrhea, or nausea, because those are more likely to cause contamination of produce. It's also important to know if your workers are taking excessive trips to the restroom, because that could be a sign that they are not feeling well. And at that point, if you see that, you should check in with your workers to make sure that they are not exhibiting any potential illnesses that could contaminate your produce. If they are ill, you should assign them to other duties that are not involving either contact with your crops or with sanitation of equipment. So some duties you might want to assign them to should be maybe office duties, or if you know that they're contagious, then excluding them from the farm. And workers should also know that they absolutely must notify a supervisor if they're ill. A lot of people are uncomfortable with talking to their workers about this, but this is important for keeping your produce safe. Regular hand washing is important, and this is a very simple step that a lot of people do not do properly, and it's really a major gap in produce safety. So to have proper hand washing, one has to scrub their hands with soap and water well for 20 seconds, getting in between the fingers, under the fingernails, cleaning both the palms and the backs of the hands, and scrubbing well. And then rinsing with water. The water needs to be potable, and the FSMA Produce Safety Regulations require that water must not have any generic E. coli in it that's used for hand washing. Hands should be or must be washed by workers after using the toilet, starting or returning to work, eating, drinking, or smoking, before putting on gloves, after animal contact, and for any other activities where there might be contact with either feces or with their mouth. It's really important to provide proper toileting facilities. They need to be cleaned and stocked regularly, and this should be something that is monitored by someone on your farm. If the toileting facilities are not cleaned or well stocked, then it's more likely that there's going to be an opportunity for contamination of the fresh produce. You need to have some sort of running water so that workers can wash their hands. A lot of times a sink with running water is not going to be available, but your local extension office can provide you with some resources for being able to provide running water even out in the fields. You need to have soap, paper towels, and garbage cans to collect the paper towels after they've been used. OSHA requires that you have to have one facility per 20 workers within a quarter mile of the work activity. And you must make these toileting facilities and hand washing facilities available to both workers and visitors. And you should let visitors know where these facilities are located. Dedicating footwear, gloves, and clothing can be a really good way to prevent contamination of your fresh produce. So for example, if you have both animal areas on your farm as well as your produce activities, keeping those well separate and having dedicated footwear for animal activities versus produce activities can be really important. Another place where you may wish to dedicate footwear is in your harvesting versus packing operations. That way you're not tracking potential pathogens into your packing facilities. And this is the same with gloves and clothing. You want to make sure that workers are removing clothing, gloves, and footwear prior to taking breaks or using the restroom. So it would be important to have a place for them to be able to hang up things such as harvesting bags or gloves before using the restroom, and potentially changing out their footwear so that they're not taking the footwear into restroom facilities. If a worker becomes injured, it's going to be really important to respond to that. Of course, you want to make sure that your worker is okay and doesn't need to go to a hospital, for example. But you also need to be concerned with the produce that they may have been in contact with. If there's any produce that has become contaminated, it needs to be discarded. Of course, workers need to treat and cover their wounds, and those need to continue to be covered during any contact with produce. So you need to keep the wounds covered. You need to clean and sanitize any surfaces that might have become contaminated with blood or other bodily fluids. And workers should know that they need to report all injuries to a supervisor. You also want to make sure that you're maintaining first aid supplies on your farm so that you have those readily available to treat your workers if they become injured. I'm going to talk about training now because this is really important, and this is sometimes a really big issue with trying to maintain produce safety and worker health and hygiene. So this is going to be the number one thing that you need to ensure is done properly to maintain safety of the produce. So number one is workers must be trained for their job. So they need to know how to do their job, the right way to do it, what tools are required for doing their job, and how to do it safely and to maintain the integrity of the produce. According to the Produce Safety Rule, the FSMA Produce Safety Rule, workers must also receive food safety training. So this is critical. They need to understand why certain steps are in place. They need to know how a lack of hand washing or improper use of toileting facilities, for example, can contaminate produce. So these are all going to be important. The training must be documented. You don't need to make it complicated, but you should document the training with the topic that was covered, the date that the training occurred, who took the training, and then store these records in case of an audit or an issue. And then workers should be familiar with potential food safety hazards and contamination sources. Workers should know to take steps to reduce hazards and contamination. So for example, if a worker sees that there's signs of animal activity on the farm, they should know what steps that they need to take to deal with that and who they need to notify, because this is going to be important in making a determination as to whether that produce can be harvested or not. So I have a picture here of a deer in a wheat field. We see that a lot up in northern Idaho here. So if somebody is getting ready to harvest wheat and they see an area where there has been a lot of deer activity and maybe a lot of deer feces, whoever's working in that area needs to know what to do about it. You need to reinforce training, and if there is issues where maybe policies or procedures are not being followed, or there is some sort of an incident where corrective action needs to be put into place, then the training's going to need to be repeated. And you may also wish to revisit your training if you're having issues with the training policies, with the policies and procedures not being followed, because the method of getting the training across may not be effective, and you might need to change that. You also need to repeat training if there's any new policies or procedures put into place, or even new equipment being used. And then you want to do monitoring to make sure that your policies and practices on your farm are being followed. It doesn't do any good to conduct training and then not do that monitoring, because then you have no idea if it really got across to the workers and if they understand what they need to do to prevent contamination of the produce. So monitoring is important. Training delivery does not need to be complicated, but it does need to be effective. So first of all, training needs to be delivered in a worker's native language. It doesn't do any good to deliver it in English if your workers only speak Spanish. So that's not going to be effective training. It's good to use a combination of delivery systems. Some people are more auditory learners, whereas others are more visual learners. So it's good to use different delivery systems for training, such as slides or charts, written materials, presenting the information orally, using pictures to demonstrate something. These can all help with worker understanding and training effectiveness. You want to make sure you provide adequate time for training. This can often be difficult, especially when you're right in the middle of planting and harvesting, but it's going to be really important to provide that adequate time for that. If the workers aren't trained and your produce becomes contaminated, then it's going to cost you a lot more than taking those 20 or 30 minutes to provide an effective training. When you're delivering the training, you also want to identify and address any misconceptions that the workers might have. For example, they might think that they have to do something because that's just the way it's done, without fully understanding that the reason why that's being done is to ensure the safety of the produce and to prevent foodborne illness outbreaks. So really being able to get that information across and identify those misconceptions so you can address them is going to be important. When you're done with the training, your workers should be aware of practices and procedures that they should be engaging in on your farm, and they should know what practices and procedures are proper and which ones are not. They should be able to follow them correctly, and they should also be able to perform their job correctly after they've been trained to do it. They should be aware of and identify any food safety issues or hazards. So for example, if the toileting facilities has run out of soap or paper towel, they should identify that as an issue and know who to report that to. If they see signs of animal activity, they should again know who to report that to and know that that is an issue that needs to be addressed. They need to follow proper hand washing and toileting procedures, and also proper clothing, footwear, and glove procedures. So if you are using dedicated footwear for different areas on your farm, they need to understand that they need to change out their footwear and the importance of that. They should know how to keep contamination from occurring. And at the end of the day, the more that they know about the risk for contamination and how to prevent them from occurring, the more likely it is that they're going to really help you out with preventing it from occurring, that they're going to be taking all the proper steps that they need to keep your farm and produce safe. They should be able to ensure that equipment and facilities are in good condition, and also that they're not going to present a food safety hazard. And then any other training that you deliver is required, they should be well versed in. At the end of the day, workers really are your first defense for preventing contamination of your produce and for notifying you if there's any issues. So it's really good to have them be well trained and for them to feel like they can come to you to discuss any issues that they see and know who they need to report those issues to. As I've talked about during this webinar, workers can really spread or cause contamination. So you want to make sure that you exclude any ill workers from coming into contact with produce or equipment. And you want to make sure that you're keeping your facilities clean and well stocked. Clothing, footwear, gloves should be dedicated as needed. And that's really going to be up to each farm to decide where you might need to have dedicated clothing or footwear or gloves, and how that's going to be dealt with, as each farm is very different. You must have proper hand washing and toileting facilities, and you want to do monitoring to make sure that those facilities are very well stocked and that workers are using them properly. With regard to training, proper training is going to be essential. The better a worker is trained, the more food safety defense they can provide to your farm. They need to know how to prevent contamination of produce and identify hazards, who to report issues to, and what to do if they see those issues. It's important that workers are trained in a method that is understandable to them and that gets the message across, and they should be trained in food safety. They must be trained in food safety. And with that, I will take any questions.
Thank you, Stephanie, for that great presentation. We don't have any questions from our audience, so we could go ahead and go to the next slide, and I'll let you know. We have a few upcoming webinars. I've just put 3 of another 7 webinars that we are going to be having over the next 2.5 months. So please consider joining us on May 14th for our Ready to Grow webinar, which is an introduction to the Produce Safety Rule. And then following that, on May 20th, an introduction to the Preventative Controls for Human Food Rule. And on May 21st, a great presentation about food safety from field to market, looking at harvest and post-harvest sanitation practices. To register for these webinars, to view recorded webinars, and learn more about food safety, please visit our regional food safety website at pnwfoodsafety.org. With that, thank you all for joining us and have a very great day.